Hello everyone, I am Dr. Abin A J, Psychiatry Resident Doctor at Govt Medical College, Thiruvananthapuram. And that's what brings me here on this occasion. June 26th is the International Day Against Drug Abuse and Illicit Trafficking. And this year's theme is Breaking the Chains, Treatment, Prevention and Recovery for All. So joining with me is Dr. Thanmay, Senior Resident at Psychiatry Department of Govt Medical College, Thiruvananthapuram, and Dr. Alan, who is Resident Doctor at Psychiatry Department of Govt Medical College, Thiruvananthapuram. So Dr. Alan, what in your opinion is addiction?
Thank you, Dr. Abin, for that question. From the get-go, I would like to start by saying we don't really use the word addiction anymore. Primarily because there is a lot of stigma associated with the word addiction that is very counterproductive to helping them or even treating them. Calling someone an addict, calling someone an alcoholic, what this does is it actually identifies the person as their drug, which is not true. A person is more than what the drugs that they use. So calling them something like that or identifying them something like that is very counterproductive to get them the treatment as well as helping them out of this problem. So in the newer versions of our diagnostic manuals, we use the terms like use disorder, primarily substance use disorders. The concept pretty much remains the same, just the terminology has changed. So what exactly is this use disorders? There are certain features that we see associated with it. So the take-home message I would like to convey would be that any sort of addiction, any sort of substance use disorder is a disorder of the brain. Like any other organ in your body, it could be your heart, it could be your lungs, it could be your gut. All of these have certain disorders and you get certain symptoms. Similar to that, a substance use disorder is a disorder of the brain. It is a chronic disorder of the brain.
So, Dr. Alan, what are the features of this use disorder?
Yeah, coming to the features of this use disorder, one of the things that we see is the people will start using this substance in increasing quantities over the course of time. Initially, they'll be coming to alcohol, which would be the most easiest for people to understand. Initially, when they start, they will drink like 1 to 2 packs a week or a month. Then gradually, after 6 or 7 months, they would increase it to once a week in the weekends. Then the amount of quantity they drink in the weekends would increase. And after that, it will become a daily drinking. So this is what we call as tolerance, or the amount of alcohol substance they consume gradually increases. Another thing that we see along with the substance use disorder, and as another feature, is craving. They'll be having this intense desire to drink. They'll be waking up in the morning saying, okay, today evening I'll have a drink, or today evening I'll have a joint or something. That will be their cause of waking up every day. This is called as craving. Then another thing is withdrawal symptoms. When they try to stop the drug after using for a long time, they'll have a certain set of symptoms that will be very unpleasant to them. It's pretty relatable because when you use a drug, you feel a lot of goodness, you feel a lot of happiness, and when you stop it, it's pretty normal to feel very unpleasant. And to get rid of this unpleasant, they start using the drugs more often. So these are the withdrawal symptoms that you see. Another feature you see with it is called as salience. Salience means you prioritize your drug use over everything else. You keep some money aside for your college fees, then suddenly a party comes, you spend all of that on the party. Or you coming to more adult population, children's school fees, expenses for the current bill, everything like that. All of these expenses, you put it aside for your drug use. This is salience. Another thing is inability to quit. You might wake up a day thinking, okay, today I'll stop drinking. And by evening, you will be like, I'll have one drink. And you will start at that one drink and you will maybe stop at half a bottle. Same thing with any of the other drugs. You're unable to quit. Even though you decide, or even though you try to quit, you can't stop from quitting. So out of all these features, if you have at least 2 of them, you can call it as a substance use disorder. Then how does the substance use disorders usually develop? Usually, I already told you, it is a chronic disease of the brain, but it is usually triggered by repeated use of a substance. You keep using it again and again, and you use it once, you don't develop disorder. Use it twice, you don't develop a disorder. Thrice, 4 times, but you keep using it again and again and again. Certain changes happen to your brain, not just in one area, in multiple areas of the brain gets affected. And that is how you develop a substance use disorder. Who develops a substance use disorder? Anyone as such is prone to develop a substance use disorder. But there are a lot of vulnerable population who is predisposed to get these kinds of substance use disorder. Primarily those with a genetic susceptibility. you have a whole family filled with a lot of substance use disorder. You're directly genetically susceptible to develop into substance use disorder. Any neurodevelopmental condition, primarily ADHD, could even be autism spectrum disorder, it could be intellectual disorder. Any of these kind of things, you're again susceptible to develop into a substance use disorder. Another thing is psychosocial vulnerabilities, early age of abuse, broken families, all of this again, there is a tendency that you might go into a substance use disorder. And the next thing is what exactly happens to your brain in substance use disorder. A lot of areas of your brain gets affected, but the primary area that gets affected is your reward circuit. There is something called as a reward circuit in your brain, and which actually, when you consume the drug, it gives you happiness or euphoria or whatever the good feeling that you get. It's because there is a lot of dopamine release in this reward circuit. But when you repeatedly use this drug, what happens eventually is that your brain only gets this dopamine high when you start using the drug. Your brain stops responding to any sort of happiness when you do any other sort of pleasurable activities, like you spend time with your friends, you play football, you play cricket, or whatever you used to previously find pleasurable. You stop getting any sort of that dopamine high from it, and you only get this from the drug use. So you gradually increase your drug use and you pretty much get stuck to it. Another thing is, with repeated drug use, your sensitivity to stress increases. There is a whole system in our body to handle the stress that we encounter on a daily life basis. So when you repeatedly use this drug becomes a primary source of escapism from any sort of stress that we encounter. And so even the slightest stress that you encounter, it becomes a reason for using the drug at that point of time. So your sensitivity to stress keeps decreasing. And the last thing that happens is your self-control losses. One of the areas in brain that gives you self-control over all your activities is your prefrontal cortex. The control of it over your habits regarding this substance use keeps lowering down. So this is what actually happens when you call someone a substance use disorder. A whole lot of areas in your brain are getting affected. So yeah.
What do you think is the burden of this particular thing? I mean, the substance use as a whole, what is the burden towards this?
So the burden, it's pretty easy to find because you can just Google and you will get a lot of statistics related to drug use. And for each of the drug there is a different percentage. As such, substance use is not a word we should use as an umbrella term. Each of the drug has a different prevalence. Each of the drug has their own symptoms and everything. But overall, it is a very large burden, and you can easily find it. You just Google it, you will get the statistics everywhere. But one thing I would like to highlight is, coming to the scenario in Kerala, there was recently a study in 2017 focused in central Kerala college students, which showed a very high prevalence of around 30% which were involved in substance use. And also there are a lot of studies that we see showing that there is increased use of substance use among school children. And also if we switch on the news at any point of time, every day you will at least see one of cases associated with some drug use. And also it's in 2020 and 2023, it has shown there is a 5-fold increase in number of illegal cases associated with drug trafficking associated as well. So the amount of burden associated with the drug use has been gradually increasing. We see that trend everywhere we look.
So Dr. Thanmay, what do you think is the reasons behind the burden is increasing, the young population is getting attracted towards the substance use? What do you think are all the reasons for these things, these changes?
Yeah, thank you so much for that question. I'd like to explain with a case scenario. Just last week I was sitting in OPD. A 25-year-old female, recently married, staying alone with a husband and a kid, came and was telling me about the issues they are facing in marital life for like last 3 to 4 years. And now they found a solution for it. They talk to each other only while drinking. So since last 1 year, they every day sit at night in the bedroom and they drink, they talk, they get pleasure, they enjoy, and then they sleep. So that alcohol has become the mode of communication for that lady. But nowadays, now she is telling that now husband is not talking to me while drinking as well. So here, this was the one case scenario. And the second case is one 21-year-old child recently came away from home for studies. Now he got recently introduced to a new hostel, where he told that I find myself very much alone in that. And then he came with a depressive picture. And when we inquired about it, he told the use of substance he used as an a mode of communication with his friends, to mingle with it. So first thing I'll like to highlight here is easy availability of the substances here nowadays. So there are so many, as Dr. Allen rightly pointed out, a coping mechanism, the stress threshold. In males, the first use of any substance was out of a peer pressure, according to studies. In females, it was out of curiosity. What is the thing that they are enjoying and I can't? So that was the main reason for the first use. When they are introduced to the first use, now they know, okay, I can feel better with it. They know their medicine now. So whenever a small stressful event, like issues with a husband, issues with classmates happen, so they resort to the medicine which they found them to be very helpful. And as he rightly mentioned about the genetic predisposition, the kids with ADHD, nowadays we are engaging into reels where we get pleasure within 30 seconds. So what all effects we want is very quick. So whenever we use this substance, it will create an illusion of problem being solved in seconds. So that creates an illusion of problem being solved for that person for that moment, though he or she knows that it is being not permanently solved. But that feeling of that solution of the problem makes them seek that substance henceforth. And as they seek henceforth, the threshold for the stressful event goes down and down. And once these things continue, for after time being, the physical symptoms develop, the craving, withdrawal, as you mentioned, develop, and they don't need any pleasure, any stressor now. It has become their habit. It has become their routine to continue that substance. Now it is like after office, I want 2 pegs. Then only my things will get ready. After waking up, so waking up in the morning to freshen yourself, to make ready for the day, that physical dependence develops, and that makes your substance a routine of your life, a part of your life. That is a major factor in continuing the substances for a long time. And the second part I like to highlight here is the stressors. Take example, like if you are scared to do something and if which is giving you pleasure in a short time, like there are so many, even in Malayalam movies are there, like even famous movie called Bangalore Days. She gets a cold feet before marriage and her friend gives her a puff to smoke, then she's like, okay, better. So these things get that small short-term relief of the fear. If you have a fight with a boss in the office, nowadays IT professionals, the environment is consideringly increasingly toxic. So they get irritated by the boss, and most of the times they don't revolt back or answer back. So what they'll do is they carry that resentment home, and then they will use the substance as a vent out for a solution for the problems. So there is all underlying fear, underlying resentment, underlying shame. If you don't feel comfortable in the crowd, or if you face any uncomfortable issue where you are being mocked by the crowd, you come home, you feel sad, you feel ashamed, and now you want to detach from the reality. So what helps you detach from the reality is the substance, which makes you feel comfortable. So that's shame. And then comes the part of isolation. So you don't mingle with your friends. Now you don't need a company to be comfortable with you. The major part of the substance is when you are not comfortable with your own self, when you are finding a company of a person who is giving validation for you. When you are not comfortable with yourself, substance comes to your resort and makes you feel comfortable for a time being, though making sure, though you know that these are not making you a solution based approach, or like you are not being comfortable for a long time. So that fear, that resentment towards someone, that shame, that feeling of ashamedness, then isolation from the crowd will all result in some selfish way to validate your sufferings, and that suffering is validated by this substance. So that is the major reason I found the substance use is very difficult once it is started to overcome.
In your opinion, how do you handle, what would you say to these people? How do you handle the issues which you have mentioned? That, for example, the peer pressure and the other lack of proper coping skills. How would you give an advice to handle such things?
Okay, so coming towards the peer pressure thing. So once you are making sure that person is very clear about his ideas, the person is not confused himself. That's the place where the assertiveness comes. You have to be very assertive with what you like and what you are not comfortable with. If you are telling that I'm not comfortable with something, I don't want this, I don't feel like doing this. If you tell this, that shows you're confused with your decision. But if you are told that no, I'm not the person who drinks or smokes or use anything, so that makes you very clear. That doesn't detach you from the other person. That makes the other person respectful of you. At least you respect yourself, not the other person. You are the person which has clarity of the thoughts. So that respectfulness about yourself reflects as a part of assertiveness. If I am being assertive with my, for example, take the example of a person who doesn't who doesn't follow non-vegetarian lifestyle. So I am sure that pretty much of so many of us are friends with people having a vegetarian diet. Still we go out with them, still we hang out with them, we are very good friends with them. So, but you know that person won't eat non-veg. Initially you tried to ask them, okay, you just try it once. But once you understood that person has his own beliefs and is very comfortable with his own lifestyle, you respect that person and you chill with him. So that changes the definition of this drug as a socializing factor. So when you are very assertive with your needs, you respect yourself. When you respect yourself, people respect you. So that clarity of thought. And second part was about the handling coping strategies. So what substance makes you is like, substance detaches you from the reality. That illusion is created. But that doesn't solve a problem. The earlier you solve a problem, better solution you get. Because you are prevented from the worst consequences of that problem. So if you are having a fight with your wife and you are drinking alcohol as a resort and that night you are sleeping peacefully, next day the fight will continue. That has not solved the fight. Right?
Yes.
So if you are having any stage fear, if you are using this substance to smoke, that hasn't solved your stage fear.
Yes.
So the solution should come from a long-term basis. You should be able to apply it over a long period of time. So coming to coping strategy, detach yourself from that condition, introspect, what I could have done better in this, acceptance, the radical acceptance of the things you cannot change, and working on yourself to change the things which are in your hands. This clarity of the thought, detaching from that current scenario, will enhance your coping strategies. So yeah, that's how I like to mention it.
Thank you, Dr. Thanmay.
So as we came here, like handling the coping strategies, but now coming towards like, okay, now we know that the person is suffering from a substance use. I would like to ask you, like, what all treatment options he can have?
Treatment options, scientific treatment modalities actually exist for the substance use disorders. This treatment can actually be generally understood in two phases. That is the initial phase, which is the immediate phase, in which we handle the emergencies and the immediate issues. That is the detoxification phase. We try to address the drug toxicity, maybe the drug withdrawal symptoms, the psychological distress that he is going through, the medical conditions which he is maybe, and also the bodily distress caused by the withdrawal as well as other problems. So the stabilizing happens in the detoxification phase. And then, I'm not going into the details, but and then comes the second phase, which is actually the relapse prevention phase. In the relapse prevention phase, we actually engage different things like cognitive behavior therapy. We focus on the thinking patterns and try to correct the maladaptive behaviors which are actually leading to the substance use. And then there is another thing called as the motivational enhancement therapy, in which we try to figure out his own motivation slowly try to, in a structured, goal-directed way, we try to enhance that motivation. We try to make him introspect, him or her introspect into the problems which he or he may not have never done it at all. In a structured way, we can slowly make them look back into their own life and figure out what all feedbacks do the events and the substance use had actually caused. And we try to make it. We try to provoke change from inside in this motivation enhancement therapy. So change from within.
So
okay, we
don't
encourage.
Force them to stop.
We don't force them to stop in motivation enhancement therapy, but in a structured, goal-directed way. It has a goal, but it has to be slowly introduced. And the main thing is actually about the different issues which were caused by this substance use and the motivation to change.
We just
from
reflect
within.
their condition to them,
Yes.
so that they introspect themselves.
Yeah, and how much they want to. And we encourage and we try to enhance it. And also there are actually self-help groups like Alcoholic Anonymous, Narcotics Anonymous. All these things are actually included in this relapse prevention phase. And we also add the pharmacological assistance is also given as relapse prevention, because anti-craving agents, etc. will be very much useful. But even though the scientific modalities of treatment exist, the main problem is actually the treatment gap which we see in these substance use disorders.
So what is making them reach this, or why these treatments are not working, or where we are lacking, Dr. Abin? What do you think?
In practicalities, this treatment gap has to be addressed. Like even in the National Mental Survey 15-16, it says that almost there is 70% above treatment gap in substance use disorders. The WHO data says that 1 in 7 person diagnosed with substance use disorder is not receiving treatment. So we have to look into detail into what exactly is happening there. Maybe one of the most contributing factors is stigma. Stigma could be at different levels. It could be in the public domain, stigma is there. As Alan has previously mentioned, how people are actually labeled as alcoholic, addict, etc. So they will, they won't choose to come for treatment. That is one problem. Anyway, public domain stigma is there. Internalized level of stigma is there. They themselves must have internalized so many negative attitudes and beliefs about themselves, and structural stigma is also there. That is the people who are supposed to be the policymakers and people who are directly dealing with healthcare providers in mental health care establishments. They also can have the biases and the stigma. This is one thing which is actually contributing towards the treatment gap. And also another thing is actually the lack of follow-up and continuity. In this lack of follow-up and continuity, practically what I have seen is actually there is a huge difference between what has to be done for that patient and what they perceive and calculate, what they regard as treatment. Like many times I have seen people coming to OP with their relative who has a substance issue and saying me that doctor, please give him counseling, 1 episode counseling and solve his issue, like that. So the idea of repeated admissions may be required for this particular thing. Many of them, they don't digest it. There is a huge gap between what they expect and what has to be done for this particular fellow. And that's the reason why even after single admission, maybe if the person relapses, then again 2 years of the same history. Another sudden admission is not happening in many cases. So there is a gap between, so that is affecting the follow-up and continuity.
And oftentimes what we say is that people don't actually see relapse as a step to recovery. Once a relapse happens, both the family members and the patient sort of give up on this. This is hopeless and things like that. But actually relapse is often a part of the whole recovery process, which actually has to be more. And there should be more
the stakeholders, the relatives, all has to be aware that it is a journey. It's a larger journey, and this much has to be done. So that expectation they are lacking here, and other issues are also contributing towards treatment gap. That is the financial barriers, gender specific barriers are there. That is females with addiction, substance use problems. They may be facing the gender specifically, and then the cultural and religious practices are also contributing towards the treatment gap. So even though we have the proper scientific modalities for the treatment, people who seek treatment is actually very less. That is the practical challenge that we are facing, but it can be addressed through realization of what exactly is the problem. First step is that, then maybe our language, our attitudes, the general
non-judgmental approach.
Non-judgmental approach has to be there. We have to make even the public believe that we emphasized on the fact that it's a brain disorder. So it's not a failure of morality that is
Exactly.
happening. It's not the choice that is happening. So that message has to be conveyed in a wider aspect, so that people's expectation regarding the treatment will also change. Only then I think that will contribute to the change.
So another thing is that substance use is very much different from substance use disorder. And I think that also need to be more, there should be more awareness on that among people. Just because someone uses a substance doesn't mean he has gone into something of a disorder level.
Mm-hmm.
And often the confusion between either of these is what actually prevents people from, like, someone could be having substance use disorder and people may be perceiving it just as a substance use. And sometimes the other side happens. He might just have used something once or twice. He might not have been actually there in a use disorder level. But sometimes the families overreact and treat him like an addict kind of level, which again often changes him to go into a track of addiction. So there should be a clear-cut difference between these two. Like, substance use disorder is what needs treatment from our side.
So yeah, thank you, Adan, for that, Dr. Adan, for the contributions. And yeah, it is very important to differentiate a substance use and substance use disorder. As you earlier mentioned, substance use disorder is with that factors. One thing I would like to highlight here is the loss we are facing due to the substance use disorders, and which is a preventable loss.
Yes.
The main part is, the earlier people were introduced to the substance in the later part of their 20s or maybe 30s, and then they were getting they were suffering from the substance use disorder. But nowadays the first introduction is at a very earlier stage. So these are all young minds and a very brilliant set of people which are resorting to this short-term use of self-medication, I'll use the word here, to solve their problems. So we don't have to validate this medication, but at the same time we don't have to negate their stressors, the reason they are resorting to the substances. So validate their problem, neither negate nor validate their kind of self-medication, because if you negate or if you oppose them, that will create a distance from you as well as from the treatment. So talk to them. We can tell them, okay, you have some issues with your life, we can handle it maybe a better way with a professional help, and this is the way you can approach towards a treatment initially. Because in the early stages of substance use disorder, in whatever little clinical experience I have, the patients will have the initial part of excellence, because they know that they will be judged by the use of the substances. So they try to excel in whatever they do. They try to excel in academics, they try to excel in their projects, they try to excel in their startups, they try to excel in their religious practices to maintain a very high image of themselves, self-image, that tells them that okay, everything is under control, though the underlying problem is not being addressed yet. The creation of that illusion to solve that problem and that overcompensation with the other behaviors creates the image of me being a very good person. But suddenly when this substance use disorder, the substance use changes to a disorder level, this all things falls apart slowly. Before you are a very good boy, very good husband, very good father, and suddenly one thing and the other, your project starts stopping. You don't seek pleasure in other things. This salient comes into place and things fall apart. So major factor, if you address it soon, it is you will preserve a very young, beautiful and intelligent mind of India. So that hope gives us work more in this field.
Yes.
So that world is getting better. It is not just that person. If one person from substance use disorder is getting better, his house is getting better.
Yes.
So it is not like one person is suffering, one house is suffering, and if we give that hope to a person, because these persons are not dumb idiot people.
Yes, yes.
They are suffering people which can do wonders
They
in the
should
world.
not be identified on the basis of the
Exactly.
substance therapy. But
They are suffering
they're
from
larger
use
than
disorder.
that.
Exactly. They are not alcoholics. there are a lot of things in their life other than alcohol, which they have created.
But they need currently
They need
help.
treatment which can make them feel fullest to their lives.
Yes.
Handle the problems properly, handle the house, and create an impression of inspiration towards others. So helping one another is a way forward. So when family is getting cured, you are getting a very brilliant mind. So I think that was the conclusion. So that is the reason why we are addressing this day importantly.
Yes.
Yeah. So thank you. Thank you so much.
Thank you so much.